Social isolation affects a child's mental health and development. Children and all human beings need close and meaningful relationships. Social support and care are fundamental needs for them. What is social behavior? It refers to an individual's thoughts, feelings, and behavior influences. Social relationships teach social norms, and it also provides students the opportunity to have friendships. Because of COVID-19 and other circumstances have prevented children from participating in the social behavior that is crucial for their well-being, mental health, and development. What are the long-term effects of isolation on children? More than 1/3 of adolescents have reported feeling lonely or the state of distress resulting when one perceives a gap between one's desires for social connection and their actual experiences of it. And almost half of all young adults are also affected. There is a correlation between mental health and loneliness. Those who are isolated are 5 times more likely to require mental health services.
Schools and daycares continue to remain closed, making it hard to get the little ones to get the social exposure that they need. Yeah, really, when you go to school, you get socially exposed, and that's a good thing. Scientists and psychologists are talking about what impact the pandemic might have on development. Our medical expert, Dr. Pyle Coley, is here now to break down some of those concerns. Dr. Coley, good morning. So how could COVID-19 possibly affect the social development of our kids?
Good morning, Gary. So there's many different theories of social development in children, but there's 2 that are especially important during this pandemic that we ought to talk about. The first is called the social learning theory, and this basically means that children learn their behaviors by actually looking at adults and looking at their peers and emulating their behaviors. And this is especially important for infants and toddlers who are learning things like emotions for the first time. So the way that kids actually learn emotions is by watching parents and watching their reactions to what they do. Now you can imagine if kids are growing up in an environment where there are not a lot of social interactions and not a lot of peers, and in fact a lot of people are wearing masks, they may not actually be able to learn these emotions normally. The second theory of social development is called behavioral development. And that means that we basically develop socially by constantly getting feedback on our behavior, whether that's positive or negative feedback from our environment. And this includes things like time out and things like rewards and other such things that happen at daycare when you're playing in a big group. Now, if there isn't a big group to play in and you're essentially playing by yourself at home, a lot of this feedback is absent. And so toddlers and kids sometimes don't really learn right from wrong and don't really understand how their behavior impacts their environment.
Sure, and that all makes a lot of sense when you think about it. What groups do you think, what age groups of kids are especially susceptible to all of this?
So we really should be watching kids of all ages, but there are 2 age groups that are most susceptible, and those are the extremes of the age group. So the toddlers and the teenagers, because toddlers are learning social behaviors for the first time by watching their environment and getting that feedback, and teenagers are essentially learning it, for the second time. They're learning how to do it as an adult, and they're trying to get that peer feedback to really come into their emotions as an adult. So those are the 2 age groups I would particularly be concerned about during this pandemic.
Yeah, and Dr. Coley can't tell, but we have an exceptionally long delay between us right now, so we apologize for that. But what advice would you give parents out there to get through this?
So Gary, the advice is that the good news is that likely short-term distancing, like weeks or months, is unlikely to have a long-term impact on your child's social development. Having said that, we could be in this mode, or some type of modified social distancing for several months or years. So it is important to know this, and it's important to keep an eye on your child's milestones. So I would recommend that you go to the American Academy of Pediatrics website, look up what milestones your child ought to be hitting if they're a toddler, or what, behavioral things they ought to be doing if they're a teenager, and really reach out to your pediatrician if there's any gaps or any concerns that they're not hitting these.
Yeah, pretty interesting.
Research has indicated that students and children who have less social interaction not only suffer educationally, but they also become more psychologically distressed in adulthood. Isolation impacts the development of a healthy brain. It is a cause of higher levels of stress. And when this occurs, the body reduces or produces more hormones. And the release of these hormones is imperative for the individual to react towards the current stress factor and resist the possible harm. However, the body cannot release these stress hormones and protect the body from stressful situations for unlimited time. When children continuously experience active stress responses, this increases their risk of developing heart disease, cognitive deterioration, elevated blood pressure, and many other consequences on their health and mental development.
There's a lot of talk these days about SEL, social emotional learning. But what exactly is it? Social emotional learning is the process of learning social and emotional skills. And it's just as important as learning reading or math. This learning process is most effective when it begins early and continues through high school. Social emotional skills are essential for success in school, work, and life. With SEL, students learn to manage their own emotions and behaviors, have empathy and show care and concern for others, solve problems effectively, make responsible decisions, and maintain healthy relationships. Students learn to recognize what's happening inside them and to be aware of their emotions, which helps them deal with strong emotions and impulsive behaviors. It helps them stop, take a breath, and think about a situation before acting. Students learn to identify others' emotions and perspectives, which helps them empathize and show compassion, no matter who they are or what their background is. It's not difficult to imagine how this is important in the classroom and in life. Students learn to solve problems in peaceful ways and communicate assertively about what they need or want. This helps them get along with other students and get the help they need from adults. When students learn to make responsible decisions about their lives and their future, things can turn out better. Research shows social emotional learning makes a difference. Students who participate in SEL do better academically, have improved attitudes and behaviors, and act in delinquent or disruptive ways less often. In the United States, students with strong social-emotional competence are twice as likely to earn a college degree and nearly 50% more likely to graduate from high school and have a full-time job by age 25. Just as important, students who are socially and emotionally competent have more friends. This means they're more likely to feel connected to school and do well, and less likely to be left out or bullied. Simply put, by participating in social emotional learning, students learn the skills to succeed in every facet of school and the rest of their lives.
Research has also shown that social isolation impacts the development of cognitive functioning. Positive social interaction, support, and contact limits the potential harm of cognitive impairment and feelings of loneliness. There are also different effects of social isolation on different age groups. As the video indicated, the teens and the toddlers have the greatest impact due to social isolation. When students spend more time in front of a screen, whether it's a computer screen or a television screen, combined with low social interaction, this retards their social development. Many tweens and teens continue to experience depression and anxiety, and unless this is addressed, they can have a lifelong effect. It was very unfortunate to see teenagers miss sports events, their proms, graduation, and school districts and families had to resort to alternative measures to celebrate these important milestones in their life.
Challenging, unprecedented, uncertain. These words all describe what we're experiencing right now as students, educators, and families are faced with navigating a new normal. But as we plan for the school year ahead, one thing's clear: the intrinsic value of social emotional learning, or SEL. Here's why. 1. SEL can foster a sense of safety and be used with trauma-sensitive practices. Students can't focus on learning if they don't feel safe and supported. The COVID-19 pandemic and the crisis around systemic racism have created traumatic experiences for many families. These experiences contribute to fear, anger, and anxiety, and increase the risk of toxic stress. As part of a trauma-sensitive approach, SEL can help students manage their emotions in a safe and supportive way and set them up for learning success. 2. SEL helps build positive connections and relationships. This upcoming school year involves a lot of uncertainty, and site closures have made it difficult to maintain the strong relationships that previously developed between students, teachers, and families. This fall, whether you're planning for in-person or remote teaching, using SEL to build trusting connections within your learning community can help lay the necessary foundation for academic learning. 3. SEL helps address the learning inequality caused by school closures. Remote learning is inherently challenging and not always appropriate developmentally. Students who are already struggling socially or academically are often the ones who face more severe challenges with remote learning. SEL can play a key role in helping students build the skills they need for effective learning, from self-regulation to problem-solving, especially in an out-of-school setting. 4. SEL provides support to teachers and staff. It's more important than ever to care for educators' well-being. By helping teachers and staff manage stress, build trust with students and colleagues, and stay engaged at work, SEL can strengthen the whole school community. Now is the time to bring SEL front and center. But don't just take our word for it. In a recent survey by CASEL with responses from 37 states, 84% reported that SEL has increased in importance as a response to the COVID-19 pandemic. And 78% of states reported that district-based SEL requests have increased since the beginning of the pandemic. We often talk about SEL in terms of improving behavior or its academic benefits. But SEL also builds skills that help bring us together in times of crisis and in everyday life. And in this uniquely challenging moment, SEL is a critical tool in both addressing the immediate needs of students, families, and staff, and helping them succeed in the new school year.
In conclusion, these are some strategies in which you can increase social interaction as we participate in social distancing and try to survive the COVID-19 pandemic. Make sure that you have virtual teamwork, have daily check-ins with your social workers, counselors, mental health therapists, teachers, and parents. Virtual meetings, virtual town hall meetings, and assigned meetings throughout the week are very good with students and for children. Validate your students' feelings. And if we do this, we can protect the social and emotional health of all of our children.